And I think one of the things that we're really fortunate to have on the program every single month is, I'm not sure who's better at it than Bill Taranto on the digital health investing side, but we have a monthly program with Bill talking to another or a group of digital health leaders in the ecosystem. For those of you who don't know Bill, he's the president of Merck Global Innovation Fund, a $1 billion plus fund, Evergreen. That's not only exited Preventis for over $1 billion this year, but also helped fund Get Up and Starting, and then taken public, and then exited Livongo to Teladoc last year for $18.5 billion on $93 million in revenue. So very, very fortunate to have Bill here again, and with another superstar in digital health. Amit Phadnis is with GE Healthcare, is a chief digital officer, and again, really, really happy and honored to have Bill and Amit here. And with that, handing over the virtual microphone to Bill. Bill, thank you for joining us today.
Thank you, and hello everybody. Good morning, good afternoon, good evening, depending on where you are, and happy to be joined by Amit today. And we're going to talk a little bit today about digital adoption, but before we do that, Amit, one of the first things I wanted to ask you is, just so the audience gets a feel of your background, can you talk us through your journey a little bit from Cisco, and then how did you end up as the Chief Digital Strategy Officer at GE, and what was your journey in getting there, and why the interest in digital?
Thank you. Thanks, Bill, and folks, good afternoon, good evening, good morning, depending on where you are. So look, I've been in healthcare for about close to 5 years now. Joined GE Healthcare about 5 years back. Before that, I had basically a tech, software, digital communications background. That's the way I can describe it. So with Cisco for 15 years, I was running their platform, which is also called iOS, like the Apple iOS. It's in the networking and communication space. So when G called me, actually, it was a bit of a sort of surprise, and I had to say, I think maybe you're not talking to the right person, because I'm not a healthcare person, and at that time I was in Bangalore, and I had to move for this role from Bangalore to Milwaukee, which was quite a transition as much as the technology transition itself. But look, it's been a phenomenal journey. I joined about 5 years back. My role from the start was driving digital transformation in GE Healthcare. Joined as the head of engineering or CTO for the imaging business. And then that's where I conceptualized what is now known as the Edison platform, which is basically the digital platform that we have built over the last 3 years. But as we did that, the company thought that it would be great for me to sort of, make use of that platform across the board, across all of our divisions. And then over time, some more businesses got folded into my portfolio. But that's essentially what I've been doing. So I actually drive the Edison platform, and I also run a P&L, which is called, Enterprise Digital Solutions, which is basically a set of solutions, software applications, post-processing tools, which run radiology departments, enterprise data archives, obviously AI and digital and analytics, sort of software and portfolio. So that's really my role at this point in time.
Fantastic. Well, thanks for sharing that with the audience. So as I said today, the discussion today is going to be about digital adoption. So my first question is, as you look at healthcare organizations, and in your mind and from your perspective, not only from GE, but just generally as you look at healthcare organizations, why is it important for them to adopt these types of technologies in digital? Why is that good for their business?
Yeah, I think that's a great question. Look, if you look at healthcare across the globe, by the way, not just in the US, but you in developed countries as well as in developing countries, I think there are 3 or 4 sort of significant issues that the health systems face. First and foremost, from a patient perspective, the access to basic healthcare is still a major concern, right? More than 3.9 billion people do not have basic access to healthcare even today. The second is the cost of healthcare is still very, very high in most parts of the world, and there's a large percentage of the population that cannot afford even basic healthcare, let alone sort of more advanced sort of care that they may need. The third thing is, while there has been a significant investment in technology, if you talk to the healthcare professionals, they still report burnout on a consistent basis. And then on the other side, if you look at patient outcomes, there are significant errors that creep into healthcare at this point in time, right? There are anywhere between, if you if you walk into an hospital today, or if you now walk into a virtual hospital at this point in time, there's like a 3 to 10% chance, even today in the best hospitals across the globe, that you might be misdiagnosed, you might get put on a, not necessarily the most optimal, treatment path. It's obviously terrible for the patient, but it also creates a huge amount of wastage in the health system, right? In the US alone, there is $1 trillion wastage in the health system at this point in time. If you look at OECD data, almost they say 20% of their total investment is what they classify as pure waste, right? Now that just tells you that while there is a lot of technology that has been adopted already, there's a tremendous opportunity to, improve access, reduce burnout, use technology and digital and data much more effectively, so that the patient outcomes are much better than what they are today, while reducing wastage in the health system. So I think those are all the drivers, frankly, from a digital health perspective.
Okay. If I could, I'd like to just follow up on two parts of the answer you just gave. The first is on access. We saw with COVID, certainly, that telemedicine, there was a rise in telemedicine, but in a lot of rural areas, or even countries that don't have access to that kind of technology necessarily, where do you think digital then plays a role in access when some of the larger technologies that we saw play out in COVID aren't necessarily available?
No, I think that's a great question. In fact, the general question on the table is, does it create a digital divide, right, among the patients, haves and have-nots, because of the digital technology? I think, look, there are multiple ways in which the technology can be used for patients who may not necessarily have, proper access to technology itself. First and foremost, look at the population health data itself. That has nothing to do with individuals. That data can be processed a lot better, right? I mean, you can literally look at the PIN codes, and you can sort of, analyze the data from that particular area much more effectively. You can do a lot better risk stratification. Essentially, what type of disease patterns are prevalent in a particular area, and so on and so forth. So you can actually narrow down the focus of healthcare into specific areas and locales independent of individual access to technology. So that's one thing that is definitely possible. The second thing is, if you look at it from a pure technology perspective, there is a large part of the population which doesn't necessarily have access to either good communication mechanisms or smartphones and things like that, right? But they do have access to some things, right? And you need to look omni-channel, right? For example, you'll be surprised that there are many places in remote areas in India as well as in Africa, Eastern Europe, Latin America, where people may not have a smartphone, but they have a TV. They have a normal phone and a TV, right? So I think the challenge in front of us is, can we use omni-channel mechanisms of communication, right? Can we also become a little bit more, sort of independent of the specific languages that people are using, so that they can communicate with whatever mechanism they have, right? But the communication back can happen through an omni-channel mechanism, right? So there are many of those things that need to come into play. I think there is some tremendous work happening in that area as to how can you effectively utilize whatever you have, right? Whatever device you may have or access to device you may have, to sort of communicate from a virtual health perspective overall. So look, I think, it's an opportunity, but as you said, it can if not done carefully, and if you don't consider different segments of population and their, sort of social and economic status, you can actually very well go the wrong way, right? But done right, you can use technologies and communication mechanisms very, very effectively to actually cover those parts of the population that don't get covered very easily today.
Great, great. So the other area I wanted to kind of focus on as well is the clinical outcomes piece. One of the great things, for example, about HITLAB and the Breakthrough Alliance is they can do clinical validation of a lot of digital, programs, but that's not necessarily accessible worldwide. And to get outcomes, how do you think about clinical validation of these digital tools in the marketplace? whether it's here in the US or whether it's outside the US, that's one of the big things, I come from pharma. One of the big things we're always looking for is a clinical validation in anything we do, but that's not easy to come by. And that seems to be one of the barriers or potentially of adoption, is that some of these assets don't have clinical validation. Just kind of wanted to get your broad thoughts on that particular subject.
No, I think great question again. Look, this is a major area of work as well as a major challenge at this point in time. Because if you look at digital and if you look at, biology, analytics, and AI, okay, and if you look at the entire startup world at this point in time, what you see is 90% of these startups have great algorithms. I mean, they've built a very good algorithm, okay, but they're not successful. And there are 3 or 4, real challenges that they face. The first is the data sets that they have used to build these algorithms are pretty narrow in scope, right? So you might have data from a particular hospital, you might have data from a particular region, you might actually build an algorithm, and with the data set that you will use to validate that algorithm, if it comes from the same region and same source, you might get a very, very good efficacy for the algorithm. But when you try to deploy that algorithm globally, it does not work, right? That's the first challenge. The second challenge, obviously, is that no algorithm is good if it cannot be fitted in a clinical workflow, okay? And that goes to your point about clinical validation. So there are 2 things that are really required. When you actually look at digital tools and when you specifically look at AI and analytics, your validation data sets have to be very wide in variety, okay? It's not about the quantity of the data, but it is about the variety of the data that you are able to sort of use from a validation perspective. The second thing is for it to be clinically validated, you have to be able to orchestrate your algorithm in a clinical workflow. Okay, independent of a clinical workflow, first of all, the use of the algorithm is a challenge, but the validation of the algorithm is a major challenge, right? So I would say, 2 major issues here is basically the variety of or variance of the data sets itself that are used in many of these digital tools and algorithms. And then, what we find consistently is lack of workflow knowledge and the lack of integration of these tools into actual clinical workflows, because clinicians have a particular way of working, right? They would not change the way because of the digital tool set. The tool set has to fit in an existing workflow. And if that transition is not smooth, you find great difficulties in actually getting people to adopt the technology or even validate the technology in general.
Okay, so let's talk back about adoption. And again, I'm going to ask a question around that workflow, but let's just talk developed nations for a minute, like the United States. One might say that though digital health has flourished over the last 6 years, adoption might be still considered somewhat slow. I actually believe part of the issue is workflow. That, to your point, it's not being put within the workflow that makes the use of that digital tool easy. Aside from workflow, what other barriers do you think there are to adoption, generally speaking? And I'm talking more developed countries at this moment.
Yeah, I think look, the workflow is obviously one of them, but the second area that we see challenges in is if you look at a health system at this point in time, there is a tremendous amount of data that is available, right? There's a data in the labs, there's data that you get from the scanning, there is genomic data sets, digital pathology, so on and so forth. Now, more and more data coming from homes. The problem is a lot of this data is fragmented and siloed. Okay, so you might have the home data coming in and getting ingested, but that's quite siloed from imaging information. That's siloed from the EMR, the information that is there about the patient in the EMR. That's siloed from the lab information, digital pathology information. What essentially then ends up happening is when you build tools or when you build applications on that data, those applications get vertically siloed, right? And that basically then results in a very unoptimal workflow eventually. Because now, and we talked to a number of, care pathways and, talked to a number of clinicians. I'll give you an example from oncology. Today, if you look at the way an oncologist works, right? typically for a given patient, they swivel chair between 5 or 6 different applications, sometimes on different workstations. It's for the same patient. And all of the data for that same patient is there within the health system, but it is fragmented and it is very siloed, right? So I think that's a major issue, and that actually results in a significant amount of data siloing. The second thing is because of this siloing, a lot of digital tools are not able to effectively make use of multimodal context, right? So for example, you have genomic information, you have imaging, and you have digital pathology. You're looking at them in silos, but you're not really necessarily correlating what you're seeing in digital pathology to what you're seeing in genomic to what you're seeing on the scan. And that correlation today happens in the clinician's brain, right? That's not necessarily very optimal because then there's limited value in the digital tools. So I think, fundamental barrier that needs to be crossed here is to make sure that there is multimodal data aggregation, infrastructure that is put in place and an effective, I mean, we call it patient jacket, but, just think about it as a comprehensive patient record. You'll be very surprised that even in the most advanced hospitals today, the comprehensive patient record finally ends up on a CD that the patient has to carry, right? It is not there, it's not on the cloud or in the system. Patient consent is still quite a bit of an issue, right? So you don't have systems that can seamlessly link patient consent, to use of that particular information across the health system. So I think those are some fundamental barriers if you see apart from the workflow. In some ways, the workflow actually gets affected because of all of these issues.
Yeah, understood. So one of the parts of your answer that also intrigues me a little bit is from a public perspective, I think part of the maybe lack of adoption might be around handling of patient data and the privacy, and then coupled with that cybersecurity and any breach of that particular types of data, and just generally your thoughts on patient privacy and then any kind of potential breach of that patient privacy. And maybe how much is that slowing adoption sometimes?
Yeah, and actually, to be frank with you, the technology is there, but the concerns exist. So if you talk to the CIO organizations today, one of their biggest concern would be what happens to the data privacy as you do more and more digitization. It's happened in all other industries, right? Wherever there has been significant digitization, there have been significant cybersecurity concerns. The infrastructure exists, but that infrastructure needs to be up-leveled, right? And it has to be across the continuum of the data. So, if you secure parts of your data pipelines or data infrastructure or application infrastructure, but if you leave even a small sort of set of that unprotected, you can compromise the entire system, essentially. So the ability to look at the entire cybersecurity framework end to end, and the challenging aspect now because of the pandemic, obviously, and virtualization and distribution of the care delivery model, is that security now gets distributed across areas that you don't necessarily control as an enterprise. For example, when you talk about a home health, you may, as a provider, you would like to control the patient journey, but you don't necessarily control all aspects and all systems that are there at home because there may be a lot of third-party infrastructure that you're interfacing with. So your ability to sort of deploy an enterprise-wide cybersecurity framework, right, especially in a distributed care delivery model, is pretty challenging. And I think, the good news is there are technologies that exist. They need to get deployed. There has to be a confidence build out, that needs to happen on the provider side, that the infrastructure is really and truly secure, right? But there is more work to be done in that space, certainly.
Okay. Well, I think we're just about out of time. Stan, do I have a few more minutes, or can I ask one last question, if that's okay? I'll ask one last one only because I'm the chair of the Breakthrough Alliance, and I always like to put my pitch in for the Breakthrough Alliance and HITLAB. Just wanted to kind of get your thoughts on how you see, for the community that's out there listening, why should they partner with the Breakthrough Alliance and HITLAB? Why do you think Stan's organization is extremely important to the rise of digital health?
Well, so look, this entire game is of an ecosystem, right? And there are multiple parties need to, sort of come together to actually create these solutions. We in GE Healthcare, we strongly believe that 75% of digitization will happen even in the scope of what GE Healthcare does, outside in the ecosystem than within GE Healthcare. And I think HITLabs, and the forum here is an absolutely key, to sort of bring people together, bring a number of ideas and thoughts together, to really sort of think through out of box as to how different peoples and experiences can be actually utilized to solve some of these issues. Because if you look at the issues in healthcare today, right, they are pretty significant, right, across the globe, and it does require a significant out of box thinking for every company.
Okay, well, fantastic. Well, thank you, Amit. Thank you, Stan. Another great session today. I appreciate the time. I'll turn it back over.
Thank you.
That's wonderful. And again, thank you, Bill, for just a tremendous Q&A, and thank you, Amit, for joining us. We know how both of you are, or how slammed you both are with everything that's happening in digital health and the healthcare system. And so thank you both. A virtual round of applause from the audience today from around the world.